certainly on the preventative care aspect and what will be covered and be required to be covered under the new law, that certainly would be that's music to our ears, because as a primary care facility, it's our mission to keep people out of the emergency room.
So we've recently received $429,000 under the School-Based Health Center Upgrade Initiative, which is part of the Affordable Care Act program. This is going to allow us to expand and renovate school-based health centers throughout the state of Connecticut.
The comprehensiveness and the cost-effectiveness of care makes us the model for universal health care in this country, and health centers have always been that model.
My parents are small business owners in Portland, Oregon. They qualified for the ACA's small business tax credit and got almost $13,000 in tax credits that year, which have been extremely helpful in keeping the business going and hiring new employees.
Affordable Care Act, and of course the tax credits. All these things make it possible for a company like mine to be able to have a more attractive company, to pass out bonuses if I need to, or to bring in a part-time, which I've done, a part-time engineer to help out in the studio. All of these things help lower our premiums and put money back into the small businesses' pockets.
Well, the small business tax credit is something that it's only a benefit. There's no downside to small businesses. If a small business qualifies for the tax credit, they get the tax credit. Regarding businesses of more than 50 employees, they will be required to offer coverage to their employees. 96% have less than 50 employees and have absolutely no obligation to do anything different than they've been doing to date. Only 4% of all businesses in this country have more than 50 employees. 96% of those businesses already offer health coverage. They've already deemed that it's important to their business to attract and retain employees, and those businesses will be able to just keep doing that as they've been doing it to date.
Jax is 7 months old now, but when I was pregnant with him and his twin brother, I found out that he had a congenital heart defect that goes along with a genetic disorder. We would move mountains to pay for life-saving health care for my child and for his brother and his sister, but that we don't have to is the financial security that comes along with this law makes a world of difference for my family.
I have been in treatment now since the 1st of December. I'm in the middle of my chemotherapy treatments, and within a couple of months I should be done with the bulk of all of this, but it's all because of the Affordable Care Act.
We're worried again because if the Supreme Court gets rid of the health care bill, my daughter will never be able to get health insurance again for the rest of her life because she has asthma, post-heart condition, all of these many things.
In going to the emergency room, the cost is much, much higher than if you're able to afford health care and just follow with a pediatrician and not have to go to the ER for, small diagnosis like an ear infection or a cold, which can easily be managed if you have insurance.
The federal government is acting with the Affordable Care Act in places where it's necessary for the national government to provide a national solution to national problems. And where possible, the Affordable Care Act gives significant discretion to the states. That's the best of our nation's federalism, providing a national mechanism for reform when states can't address the problem on their own, and yet giving flexibility to the states to take advantage of the state's closeness to their people, being able to craft policies that reflect the diversity of America's people and places.
One of the objectives of health reform is certainly to lower healthcare spending, and one of the problems with the current healthcare system is that providers are reimbursed in a fee-for-service basis. They're paid for every single procedure they perform, and that of course only encourages overutilization and overuse. And so the healthcare really tries to tackle that by putting forward different payment models, paying providers in a different way, rewarding quality, rewarding care coordination, based on the premise that if you pay for quality care and not just for providing more care, that eventually it's going to be in the interests of healthcare providers to keep people healthier, and so you're going to see less instances of chronic conditions and the costs are going to go down.
Just in this area alone, if we achieve our targets over a 3-year period, you're talking of savings of millions of dollars. So if that's just in this one district of Brooklyn with 2 hospitals, imagine if it's across the country. The whole purpose is to try and prevent an unnecessary rehospitalization And we are confident because this has been tested out in other parts of the country, and we're beginning to see early results ourselves.